Hi, I'm Tricia Gibson, therapist with Connective Clinical Counseling. I wanted to share today reasons why people with trauma often feel isolated. So, people with trauma aren't always just veterans with combat related trauma, but it's certainly a valid experience leading to trauma response. But other people can also experience trauma, such as victims of domestic violence, victims of sexual abuse or rape, victims of childhood abuse or neglect, people who've been emotionally abused, people that's been in car accidents, people that's lived through natural disasters, people that's also had medical related traumas, victims of crime as well. People with trauma often experience flashbacks, and these are very vivid memories of the traumatic event in which they relive over and over. They also can experience intrusive thoughts, so thoughts of the event popping in their mind just very randomly. They can also experience nightmares or distressing dreams related to the event. They can constantly feel on edge, a sense of anxiety. Depression is also common with trauma, a sense of hopelessness or helplessness. There are some beliefs that people with trauma often obtain. I've worked in clinical practice with trauma for a few years now, and I've often experienced patients tell me that they believe I'm not okay, or they believe the world's not safe. I should have done something. I'm defective. I'm not lovable. I'm not good enough. Those are just a few examples of beliefs people with trauma obtain because of something terrible that's happened to them. But I want to share that you're not alone. These are very common responses to trauma, and people that's been through a traumatic event often feel as though they're alone in this, that no one else could possibly understand, and they feel a sense of helplessness or hopelessness when it comes to improving these responses. People who's experienced trauma often feel isolated in this response because they feel so alone in the event itself. They feel very unrelatable to other people. And also, the symptoms that they have, flashbacks, the anxiety, depression, feeling on edge all the time, avoiding certain people, places, or things, they feel very impaired in what they're able to do on a daily basis. It's different from before the trauma. I like to tell patients I work with that their responses are very normal to abnormal circumstances. In other words, if someone else had went through something similar, they would probably be having similar responses. So I always like to normalize how patients with trauma are feeling because it is their lived valid experience. And if you would like to learn more or schedule an appointment for counseling, you can reach out to me by phone 740-247-5463, or you can visit my website www.connectiveclinicalcounseling.com. Thanks.